Hi, Sally Walker here, your hormone and slow age expert. So what is the difference between osteoarthritis and rheumatoid arthritis? Because they are very, very different disease states. So arthritis in general is one of the leading disabilities worldwide, and there are many different types of arthritis, but they're principally divided into osteoarthritis and rheumatoid arthritis. So the osteoarthritis is a degenerative condition where your rheumatoid arthritis is more an inflammatory condition and more systemic and can also affect other parts of the body than just the joints. So osteoarthritis is very commonly associated with aging. So we see it more so in the older generation. Though if you have some kind of joint injury, you damage your joint in some way and don't get it fixed, then you can actually create an arthritic state earlier rather than later. So if you do have joint damage and joint injuries, and there might be something to do with your sport, or there might be an accident, whatever, make sure that you get professional help as quick as possible. So check out a doctor, an osteopedic doctor, or an osteopath, or a chiropractor, or a physiotherapist for that matter. Get professional help to find out what exactly you have damaged and get it fixed as quick as possible so you don't set yourself up for degeneration, arthritis, earlier rather than later. Whereas the rheumatoid arthritis is an autoimmune disease, basically. And there are many reasons why your immune system has gone crazy and is now attacking your own tissue, which will give inflammation and inflammation flare-ups around the joint, in the joint, and can also be other organs like heart, lung, and things like that. So typically with the rheumatoid arthritis, you will see from the outside that the joints are swollen and red, and they'll be very painful, and they can be very warm when you touch and things like this. These are very classic symptoms of rheumatoid arthritis rather than osteoarthritis, which we don't often see from the outside. Yeah, and there can be many reasons why rheumatoid arthritis starts. And one of them can be your gut health. This is actually very well proven that there are certain gut bacteria which can increase the risk for developing the autoimmune disease rheumatoid arthritis, and is called Prevotella. So maybe you should check out your gut health and see if you have an overgrowth of these bacteria and other bacteria which can increase your risk for developing rheumatoid arthritis. So smoking is something that goes to both. It's going to increase the risk for rheumatoid arthritis, and it's also going to increase the risk for osteoarthritis. So, I have absolutely nothing good to say about smoking. That glass of wine every now and again does have some very good, positive things related to health, but smoking does not. So smoking is going to increase your risk for osteoarthritis, but it also will increase your risk for rheumatoid and will make your symptoms of rheumatoid arthritis much more severe. So there are lots of articles in the blog, and one of them is the risk factors for rheumatoid arthritis. The other one is risk factors for osteoarthritis. So have a little look at those, because you want to be preventing, and there is an article called Preventing is Better Than Cure. You want to be preventing these things from starting as much as possible. So while most of us are going to get some kind of osteoarthritis in one or more joints, most of us fortunately do not develop rheumatoid arthritis, but some of you may, or some of you may also already have rheumatoid arthritis. So check the articles and have a little look at what you can do to ease or remove your arthritic symptoms. Happy hormones, happy life.